Hello.
Hello, Dr. Fauci. How are you, sir?
I'm very well, thank you. How are you?
We are doing excellent. Thank you very much. My name is J.R. Gonzalez. I'm going to be your moderator. And whenever you're ready, sir, we are ready to get started.
Well, thank you very much. And let me take this opportunity to thank you for giving me the opportunity to make a brief presentation to you. I've made it, I know that we have people who are mostly involved in normal non-scientific life and others who are more scientifically bent. So I'll try to get a golden mean between the two and talk about COVID-19 and some of the public health and scientific challenges to give you a feel for what we're dealing with and really what the future might hold.
Dr. Fauci, we want to thank you for not only your time of spending, we just have a whole lot of questions, as you well know, especially when it comes to the Latino community and the minority communities of this disease. But we're not going to waste any time. We're going to go right into it. For a man who needs no introduction, of course, we just have Dr. Anthony Fauci join us. He's the director of the National Institute of Allergy and Infectious Disease at the United States National Institute of Health. We're going to start off by introducing Sam Guzman, our chairman of the board, for a few words before we get started. Mr. Guzman?
Yes, thanks. And welcome, everybody. Bienvenidos. We have participants from throughout the state and actually throughout the nation, state officials, city and county officials, educators, hospital personnel, community and community leaders, chambers of commerce, and most importantly, families and individuals for over a total of 1,000 registrants. This is indeed a big deal. And we are most fortunate to have with us what is considered by everybody the foremost expert in the field of infectious disease. As important as that is the fact that we trust him. People trust him. We appreciate the work that he's doing and has done, and particularly in the environment that he has to do it in. We know what that environment is, and we understand Dr. Fauci. Dr. Fauci, I don't know what we would do without you. I am personally a big fan, and I would like to officially sign up as the chairman of the Dr. Fauci fan club. Thanks, sir.
Thank you, Mr. Guzman. Also on the line, President and CEO of TMAC, Pauline Antone. You see her there. She'll be joining us a little bit. She'll be speaking a little bit later. Dr. Fauci, the person who's going to be asking the questions after you speak is Justice Isela Triana of the Texas Court of Appeals. She's the other young lady you see on the screen, and she'll be asking the questions. So, Dr. Fauci, without further ado, people are anxious to hear from you, sir. I will turn it over to you.
Thank you, sir. Let me then just jump right into it and just very quickly go through this presentation. So I'm going to talk to you a little bit about the public health and scientific challenges and try to make it as simple as I possibly can, but not to the point where we make it so simple that we're not really understanding where we are. Some time ago, I wrote an article in the Journal of the American Medical Association as a viewpoint, and I entitled it Coronavirus Infections More Than Just the Common Cold. I wasn't trying to be facetious because people don't fully appreciate that we've known a lot about coronaviruses for a very, very long period of time. So let me explain. This is what's called a phylogenetic tree. Don't be taken aback by it. It's, the way scientists look at the origin of viruses. So this means that all the coronaviruses are listed here. But notice that 4 of those that are highlighted in yellow, interestingly, are the coronaviruses that you and I and everybody on this call experience every year. So 15 to 30% of all of the infections that are common colds that you and I get repetitively each year, 15 to 30% of them are one of those 4 viruses. And we often get it repetitively year after year. But then in 2002 and 2012, 2 coronaviruses emerged that had pandemic potential that not only gave you the common cold, but it actually could kill you. You remember the SARS outbreak of 2002 that started in China and then went to the rest of the world? SARS stands for a severe acute respiratory syndrome. It burned out by itself because of good public health measures. That virus did not have an efficient capability of spreading from person to person. Then in 2012, we had MERS, or the Middle East Respiratory Syndrome, another coronavirus that emerged from an animal reservoir the same way that SARS did. The animal reservoir was a bat to an intermediate host to a human. That too smoldered along. Then these are the two as shown here, the severe acute respiratory syndrome and the Middle East Respiratory Syndrome. Then fast forward from 2012 until now, 2020, yet again, another coronavirus emerging from a wet market in China, again traced to a bat and an intermediate host. This is what it looks like. It's very similar to the other coronaviruses. It has two characteristics, though, that are very, very sobering. One, it spreads incredibly efficiently from human to human. And two, it has a high degree of morbidity and mortality for certain subsets of people, which we'll get into in a moment. So what is this virus doing? This is a virus that causes COVID-19 is the name of the disease. The name of the virus is SARS coronavirus. That's a picture of it on the left. You see those little spikes that come out? That's why we call it coronavirus. Corona for being crown, and virus because it's a virus, because it looks like a crown almost. That's where you get the name. What happened? It exploded upon the globe. And right now, as we speak, this was from yesterday, but now we have 32 million cases and 1 million deaths throughout the world. The United States has been hit harder than any other country in the world, with almost 7 million cases. And what happened last night is we crossed over the 200,000 death mark. The various shades of color in this slide indicate the intensity of infection that's actually going on per 100,000 population. How is this transmitted? That's how it's transmitted, through the respiratory route. That can be either from coughing or sneezing, but now we know, and this is very disturbing, that even by speaking, singing, or normal conversation, the virus can spread, which is the reason why when we talk about things that are dangerous, like being in a crowded restaurant or a gym or a bar, this slide merely shows everything on the right of that line that crosses down vertically is a risk. Everything on the other side of the line is not a big risk. So look where restaurants are with that red circle. Look where gyms and bars, and even unfortunately, church gatherings, particularly when they're indoor. One of the things we've learned, and this is, again, very difficult because it makes it tough to contact trace, that 40 to 45% of the infections are in people who have no symptoms at all. They don't know they're infected, and you don't know they're infected. In fact, you may be one of the ones that's infected and don't even know it. However, the problem becomes when an infected person who is asymptomatic spreads it to another individual. So then it becomes the silent spread, which what we call community spread. And right now, there are 40,000 new infections each day throughout the United States. Some regions, states, cities, counties are doing much better than others, but some are in danger of having those surges that we have seen in Florida, Texas, California, particularly in the South, and Arizona, and that we're now seeing in the heartland of the country. How do you prevent infection? There are 5 major things that everyone should be doing. Universal wearing of masks or cloth face covering, maintaining physical distance, the 6-foot rule, avoiding crowds in congregate settings, always prefer outdoors better than indoors, and frequently wash your hands. What are the clinical manifestations? Very similar to a flu-like syndrome, fever, cough, fatigue, muscle aches. However, some individuals have a curious loss of smell and taste that precedes the onset. A wide range of disease. Most people, 85%, get very mild illness. That's what confuses people because they think, well, you know, mild illness, no problem. But there are those individuals who can get moderate disease leading to severe pneumonia and critical illness requiring ventilation and deaths. Hence, the 200,000 deaths in our country. Who are the ones that are the most susceptible to that? Well, even people who recover from the disease can have lingering symptoms, muscle aches, fever, fatigue, something that's called brain fog, which means a really difficulty concentrating. The people who are at increased risk for serious complications are older individuals and people of any age that have underlying medical conditions. And what are those underlying medical conditions? Obesity, diabetes, hypertension, heart disease, lung disease, kidney disease. So there's a lot of people in the population that have an underlying medical condition that would predispose them to a severe outcome. Also, and sadly, there's a great disparity in increased incidence of infection and increased incidence of complications among minorities, African Americans, Latinx, American Indians, Alaskan Natives, and Pacific Islanders. Look at these statistics. They're stunning and depressing. These bars show the rate of hospitalization per 100,000 population. Take a look at Hispanic, Latino, 348. Compare that to white, non-Hispanic, 75. Okay, what about therapeutics? The United States National Institutes of Health, where I work, has put together a guideline panel. It's a living document to help clinicians understand and be aware of therapies that come online after clinical trials show that they're effective. And there are a number of these that have actually been shown, particularly in late disease, like corticosteroid, dexamethasone, remdesivir, but we still need to get more therapeutics. Finally, in vaccines, that's kind of the good news story, because we have made major risks, particularly financial risks, as well as the sophistication of the science to do things at a speed that, in fact, is not compromising safety and is not compromising scientific integrity. There are now 4 vaccines that are in advanced trials with as many as 60,000 people per trial. The trial that says Moderna is 30,000. The one that says Pfizer is 44,000. The one that says Janssen is 60,000. They're in phase 3 trials. We hope, and I think it's reasonable, and I'm cautiously optimistic, that by the time we get to November or December, we will know whether the vaccines are safe and effective. I'm cautiously optimistic that they will be, but with vaccines, you never get a guarantee. You've got to do the clinical trial to prove safety and efficacy. As I said, we likely will know by November, December. It's conceivable, though unlikely, that we will know by October or earlier, but I think it's likely going to be November, December. And since we're pre-manufacturing the vaccines in anticipation of a success, that's the risk I was saying. You're taking a financial risk. Because if it works, you've saved months. If it doesn't, what you've lost is money, government money or taxpayer money. The reason I say that is because we did think it's worth taking that risk to get vaccines to people as quickly as we possibly can. And it's extremely important that Hispanics, Latinx, and other minorities get vaccinated against SARS coronavirus 2, because when we show, and I believe we will show, that it's safe and effective, we want to be able to say we've proven that it in fact is safe and effective in everyone, not just whites, but Hispanic, Latinos, as well as other minorities, including African Americans, Native Americans, etc. If you want to take a look at what the opportunity to get in the trial, if you just dial into coronaviruspreventionnetwork.org, again, coronaviruspreventionnetwork.org, you can sign up and indicate your intention of being involved in the trial. So I will stop there and I'd be happy to answer any questions.
All righty, thank you, Dr. Fauci. And at this time, Justice Triana, will you go ahead and take over and ask Dr. Fauci those questions you've been preparing all evening for?
Thank you, JR. Good afternoon, Dr. Fauci. I can't tell you what an honor and a privilege it is to be here talking to you about this important matter. Both of the physicians in my house, my mother and my brother, are green with envy that the lawyer, the judge, and the family is the one who gets to talk to you instead of. So on behalf of Texas, I want to thank you so much for everything that you've done, what you keep on doing, to make sure that the science gets out at a time where we have such a cacophony of around this subject. It is truly inspirational that we can trust you for being honest to us. So thank you so much. Without further ado, first question off the bat. The Hispanic population makes up about 39.6% of the COVID-19 cases in Texas, but 56% of the deaths. Do you know why this is the case? All around the board, this is the biggest discrepancy between infections and death for all races.
Yeah. Well, it is likely that there are two factors. One I think is more important than the other, and that is the accessibility to getting into good care as quickly as you possibly can. Because when you look at access to health and health care and health systems, clearly minority populations, including Latinx, you don't like to generalize, but here's one situation when generalizing helps you to understand the nature of the problem. But something that is even more important, and that is the increased incidence of the comorbidities that are associated with a poor outcome, make it much more likely that both African Americans and Latinx are going to wind up having a severe outcome. And those are things like obesity, chronic obstructive pulmonary disease, chronic kidney disease, and hypertension. And those things are not genetic, Justice Triana, they're not. I think they're the social determinants of health. Because if you don't have access to good health care, including preventive health care, you can have hypertension that is unnoticed if you don't have a doctor. Or you could have diabetes that's unnoticed if you don't have a doctor. Or you could wind up being obese because you don't have access to healthy food. That where you live and the kind of employment you have and the kind of financial bracket you're in doesn't allow you to live as healthily as you possibly can. So, go ahead.
I just want to verify that there's no genetic component, that the data has not shown any kind of, for minorities, some kind of a, nature versus nurture kind of thing, that we are just predisposed because of the, something in our blood, whether it's A+, A positive blood type or anything like that.
No, there's a study that showed that people with O positive are less likely to get infected than those with A positive. But the difference, Justice Triana, was so small that I don't think people who are O positive should think they're protected, or people who are A positive that think they're at a really bad risk. It's almost the same, a little bit of statistical difference, but that's all.
And otherwise, no genetic data that we have.
Not that we know of. Maybe as we do a lot of genetic studies, someone is going to say, well, the expression of the ACE2 receptor, which is the receptor for the virus, in the nasopharynx or the lungs of minority populations is greater than in the white population. But to be honest with you, I would really be surprised if that were the case. I really do think if you look at the jobs that Latinx have in society, as a demographic group, it much more likely puts them outside in the front line, in contact with people, as opposed to what you and I are doing with a computer. So they don't have the ability to protect themselves. Number two, they don't have as good access to health care. And number three, because of their lack of access to health care, because of the fact that many of them are, quote, illegal, if you want to use that terrible term, that they're afraid to get into a system that would give them good health care. So the social determinants of health that don't lead to a healthy life are going to make them more susceptible to serious disease. I don't think you have to evoke at all any genetic difference.
And I agree with you. I mean, we have a larger number per capita of essential workers that come from the Latinx community. And so I understand that. Kind of picking on that point, let me ask you a couple of questions. So first of all, what options do those that are uninsured have to get the COVID-19 testing and treatment, without having to pay thousands of dollars out of pocket, since we know that this is a population that doesn't have insurance? And how can the Hispanic business community help slow the spread of COVID-19, especially among, and we like to use the term undocumented instead of illegal Hispanics? What are your thoughts on that?
Thank you for correcting. I was trying to look at the right word, but now I'll use the right word from now on. I don't consider it illegal myself, to be honest with you. It's undocumented. What you can do is just increase the awareness. When you hear it from Latinx leaders, I hope and I think that people trust me, but I'm still a white guy in a suit, who was born in New York City. We
won't hold that against you.
So I think that they would trust more their trusted leaders to say, you've really got to wear a mask, maintain distance, avoid crowds, wash your hands, do things outdoor more than indoor to protect themselves. Everybody's got to keep getting that message going. So the other thing I think it's important is that you should know at the task force, and I'm a member of the task force, we've been told that when the vaccine is available, it's going to be free. And no one, whether they be a Latinx, an African American, or a white or anything, should not get the vaccine because they don't have the money to pay for it. It should be free, period.
Well, since you're talking about vaccines, let me ask you, once the FDA, because there is some anxiety about taking the vaccine for the first time. So once the FDA approves it, are you going to take the vaccine?
Yep.
Okay.
I'm in, I probably, because of, speaking of genetics, my father lived until he was 97 and looked like he was 70 when he died. I'm actually 79. So
you do not look 79, Dr. Fauci.
Well, thank you. But so I'm in one of those categories that I showed on the slide of old individuals. So I certainly, and I trust the FDA, I trust the CDC, despite all of the stuff you've been reading about, that they're going to be standing for science and safety. So when the vaccine is deemed to be safe and effective, I will take the vaccine, and I will recommend to my family to take the vaccine.
Thank you. So, TMAC is a organization made of business people. Obviously, many business owners are not only concerned about the health effects, but also about the economy too. How do you strike a balance with staying healthy without halting the economy?
A great question. I believe that if the entire country acted uniformly instead of in somewhat of a disconcerted way, up and down, disparate, discombobulated, or whatever you want to call it, we didn't have uniform adherence to the guidelines. Remember back when we were doing press conferences from the White House every day, we came out with the vice president's leadership in that with ways to open up America safely. And it started off, with the checkpoint, a gateway, we called it. And then you went to phase 1, phase 2, phase 3. So if everyone had abided by that and not jumped over, we could have opened the economy without the surges that we saw, particularly in some of the southern states. So the best way to approach this is to view public health measures as a gateway, a pathway, a roadway to opening up the economy, not an obstacle to opening the economy. Because in our divisive society, and it isn't my opinion, you have to be awake to see what's going on in society, that we don't consider the people who are preaching a public health message as the enemy of those who want individual freedom. You know who the enemy is? The enemy is the virus. It's not the people that are trying to control the virus. So nobody wants to shut down the economy and shut down the country. Certainly I don't. But the way we're going to open it again safely is by being careful and prudent in listening and acting according to the guidelines that we're all talking about.
Do you think that Texas is opening too soon? Do you think we're right on target? Do you think we're too slow?
Well, I think in the beginning you really had a problem. I think you're doing much better right now than you were before, for sure, for sure.
Okay. What education can we provide to doctors to assist in reducing health disparities? You know, we had talked about some of the environmental reasons why maybe Latino community doesn't get health care as often, but it seems to be sometimes that physicians, you know, there's a disparity, and is there anything that the doctors can do to help with that?
Yeah, I mean, the doctors as a group, since there are a lot of them that have a lot of influence through their societies, should actually make sure that they come down very heavily on having access to health care for everyone. I mean, the idea that we have so many people and disparately against the minorities not having access to health care is really one of the reasons why we have so many of the problems. So it would be almost a strong lobbying group. I mean, you can individually open yourselves to minority populations, some of which can't afford care, and be generous in your access to doing that. I mean, back in the day when I was much, much younger, you know, we used to operate free clinics where doctors would volunteer for nothing to go and just take care of people who could not afford a doctor, who didn't have health insurance. So those are a lot of the things that are being done. I mean, having done it myself, I can tell you that it works.
What are some of the preventative measures that people can take to boost their own immunity and to give them a better fighting chance against the virus?
You know, I get asked that question a lot. It's very interesting because somebody asked me, do I take any vitamins? And I happen to mention, honestly, you know, I take vitamin D. The reason I take vitamin D is because I used to be deficient in vitamin D. You know, I'm kind of a nerd, so I never go out in the sun. So I've got to go out in the sun, but I don't. So I work all the time. So my vitamin D level went down. And we know that when you have a deficiency of vitamin D, that you're more susceptible to certain infections. So I take a vitamin D supplement, not because I think it's going to boost normal immunity. I think it's going to restore immunity that might have a problem. The bottom line answer to your question, Justice, is that there aren't very many things that you can take in supplements that can boost your immunity. With all due respect to the thousands of bottles that you see in the pharmacy of this herb and that herb and the other thing, the best way to maintain your immunity, the integrity of your immune system, is healthy living. Good diet, exercise, don't smoke, don't drink too much, get plenty of rest, and try to the best way you can to relieve stress. Whatever relieves stress for you, try it. This idea of taking a whole bunch of things to boost your immunity, there's no scientific evidence that it boosts normal immunity. What allows you to maintain your normal immunity is what I just said.
What about the flu season? So it's coming up. What kind of potential conflicts should we expect, and how do we mitigate it?
Well, the worst scenario would be is we get a bad flu season superimposed upon a COVID-19, because when you get to the fall and the winter, a lot of things are going to be done indoors, which means that one of the 5 things that I showed on one of the slides are not going to be there, outdoors greater than indoors. So we're going to be challenged. So having said that challenge, get a flu shot. We now have ordered 200 million doses of flu. Get a flu shot. Everybody 6 months of age or older should get a flu shot. The thing we're hoping for, and this is important, the thing we're hoping for is what happened in Australia. Because Australia has their flu season from April to the end of August. And by wearing masks, physical distancing, and avoiding crowds, the Australians, in an attempt to blunt COVID-19, have successfully blunted influenza. And they've had the lowest flu season in their memory. So let's hope that with a combination of flu vaccine and good public health measures, that the same thing will happen to us.
Okay, I've been told that this is my last question, even though I could talk to you for 3 hours. Do we know when we'll have the vaccine? And will it be safe for the minority populations to take the vaccine due to the fact that most of the trials have not been done on minorities?
Okay, so we will likely know by November or December, could be a little bit early, maybe October, but very likely November, December, that we have a safe and effective vaccine. I'm cautiously optimistic that we will get there, that we will have a safe and effective vaccine. And since we've pre-ordered the doses, it likely will have doses available by the end of this year. You know, that's what one of the things we're really trying to do. We are pushing to get enrollment of minorities in the trials. Right now, with Latinx, it's not as bad as African Americans, because African Americans, we've got to get to double digits. We already are at like 16%. And the last time I Googled, you know better than I, is that the percentage of Hispanics in the population is about 17 to 18%. It used to be 16%. It's now about 18%, which means about 60 million people. So if we get 16 to 17% of Latinx in the trial, that's not so bad. So that means we are going to show that it's safe and effective in Latinx.
So we should do our part and be part of these testing.
Oh, I really recommend very strongly to be part of the vaccine trial, because when it's shown to be safe and effective, the worst thing that could happen is the Latinx don't want to take the vaccine because they say, well, you haven't proven in me that it's safe and effective. And that would be another example of depriving the Latinx population from something that would be very beneficial to them.
Dr. Fauci, I cannot thank you enough for spending part of your afternoon with us. Like I said, it's been my honor. And at this time, JR, I'm going to pass it on to you.
Thank you. Dr. Fauci, once again, thank you very much. We know your time is valuable. And you look very young, sir. You don't look your age. And we've asked you on this call, so we definitely trust you. We trust your opinion. And from all of us over here at TMAC, when you're up there on Capitol Hill talking to Congress, stick to your guns, Doc. You're doing a good job, okay? Tell them like it is.
All right, thank you very much, Mr. Gonzalez, and thank you, Justice Triana. Say hi to your brother and your father for me.
I will.
Thank you, sir.
All right, take care. Thanks an awful lot. All right.
Thank you.
Bye-bye.
Wow. Gisela, thank you very much for asking the questions. You did a great job. And we just had join us on the screen is going to be TMAC's president and CEO, Ms. Pauline Antone. Pauline, you want to say a few words and kind of acknowledge some of the people who made this whole thing possible?
Absolutely. Thank you so much for the opportunity. And I will make this very, very quick because we have a roundtable coming up that I do not want to stop. First and foremost, TMAC has been around for over 45 years. We are here as a resource, providing opportunities and always your advocate. Stay connected through our website, social media, and each of you have my personal cell phone number. So contact me if you would like to volunteer or even become a part of our leadership team. We want to thank you for your leadership by you being here. You are a leader in your community. And I want to give a great big huge shout out not only to the roundtable, the speakers, Dr. Fauci, but most importantly is the IT team over there at the El Paso Hispanic Chamber of Commerce. Y'all are amazing. So thank you everyone for being here, and watch for more information. Thank you, Mr. Gonzalez.
All right, thank you, Ms. Anton. As Pauline says, folks, this is a health issue and not a political issue. So it's important that we get this information out there. Just so you know, before our roundtable starts, we're going to introduce those folks, but we are going to translate this webinar into Spanish and get it out there. And we are going to continue work in this area to disseminate as much information in both English and Spanish and whatever languages we have access to make sure that people are getting this message. As Dr. Fauci said, the death rate amongst African Americans and Hispanics is just unacceptable. It's continuing. There's a lot of reasons for that. So one of the purposes for this call is not only to discuss it, hear it directly from Dr. Fauci, but with this roundtable, possibly come up with possible ideas or solutions or doing a little brainstorming of how we continue getting the message out to our people to make sure that they are armed with the right information and the course to take. With that, also the IT team over there. And for those of you wondering, we have people from all over the country. Pauline, we have them from where? New York, Florida, California, Arizona.
We have from New York to California, from Puerto Rico to Del Rio. So we've got people from everywhere, and we greatly appreciate you.
And we greatly appreciate it. We actually broke 1,000 people registered for this, so it's going good. With that, also want to look, if anybody's curious, we are actually broadcasting to MACC headquarters is in Buda, Texas. So we're broadcasting out of Buda, Texas. If anybody wants to know where Buda, Texas is, Austin is a suburb. They're just north of us, okay? So we're going to go ahead and, all right, Avila, can you go ahead and bring on all of our people who are going to be on the roundtable discussion? And as we're getting back on, Mr. Guzman, our chairman, would you like anything to say before we get started, sir?
No, this is a good start of what, as you mentioned, will be continuing, because obviously this enemy of ours, the COVID, will be continuing. So we will be right there continuing to fight it with all the resources that we can possibly bring to bear. And let us be your partner in this. I mean, we're all in this together. We're either going to succeed, which I know we will, or not. But we got to follow the rules: mask, distance, and so on. It's simple. It's not that hard.
And speaking of partners, Sam, I do want to recognize, and she's on our roundtable discussion, we're going to be introducing her, is Sonia Canales from HEB. Sonia, thank you so much. HEB has been a huge partner and a leader. And when COVID hit, people were watching HEB as a model of what to do. So, I mean, it's really something. We owe a lot, not only to that. And for those of you not in Texas who don't know who HEB is, you know what? It's your loss. I tell you what, best grocery store around. Get fresh tortillas, barbacoa, chorizo, everything that you need. I mean, if it wasn't for Latinos in Texas, I don't think HEB would be doing as well. So thank you. So it looks like we're getting all the folks on the table. We've picked a select group of people coming from different doctrines and backgrounds, and we're just going to go down and let everybody introduce themselves. And then we also want to thank El Paso for sponsoring, and some of the other folks, but we mentioned that. But Sonia, do you want to go ahead and start off just 10 seconds, introduce yourself, and we're just going to go around the panel.
Sure. Well, actually, I'm not going to participate in the roundtable because there's a lot of folks at HEB who know a lot more information than I do, but I just wanted to thank MACC for everything that you're doing. As he mentioned, my name is Sonia Quirino Canales, and I'm the Manager of Diversity and Inclusion at HEB. And it's an honor to be with you today as we work together to gain insight and to make change happen for all people of color. You know, for those of you who don't know, we're in Texas. HEB was founded in 1905 by Florence Butt in Kerrville, Texas, with one grocery store. And we now have more than 400 stores in Texas and Mexico and employ more than 120,000 employees who we call partners. At HEB, we believe that each and every person counts. And that's why we feel that this information that Dr. Fauci shared with us today is so critical. We've done our part to help slow the spread from constant and thorough cleaning and disinfecting in our stores and other work locations to enacting social distancing and promoting the use of masks, we are committed to doing our part to help slow the spread. You know, this month is at HEB, we are celebrating National Hispanic Heritage Month. Yes, it is a time of celebration and sharing our orgullo, our pride in who we are as a community. But what's even more important is the education of the Latino experience. Our accomplishments, our cultura, our history, our struggles, and yes, definitely how this pandemic is taking hold of our gente, our community, and what we need to do to overcome it. So on behalf of HEB and our partners, thank you to the Texas Association of Mexican American Chambers of Commerce, to Dr. Anthony Fauci for hosting this webinar to provide critical information for our Texas communities that will reduce the number of COVID infections and fatalities. Muchas gracias. I'm going to leave you with that, and so you can continue with the roundtable. Thank you so much.
Thank you very much. One of our roundtable participants is going to be Cindy Ramos Davidson out of El Paso. And Cindy, thank you for you and your team, and not only your sponsorship and making this possible, but Cindy has an entire team of technical people on her end to make sure that this webinar runs smoothly. Cindy.
Yes, hi, thank you all. I am so proud of what we did today, Pauline and JR, to mock. Thanks I'm sure you all didn't get any sleep. We were just the back office technical support to Pauline and JR as the El Paso Hispanic Chamber, but I am blessed to be involved with the Texas Association. I am the CEO of the El Paso Hispanic Chamber, and I am truly blessed with Italy and Daisy and Patrick and all the team that I drove absolutely nuts and told them, you cannot mess this up. We have an important guest, so thank you for allowing us to play that part and be involved. We do represent 1,400 minority businesses in our market. We have a team of 21 on staff. 2 of them are gentlemen and the rest are young ladies. So thank you for allowing us to be involved. This was really awesome. I wanted the HEB lady to say, they need to come to El Paso. I'm tired of going and buying my coffee in Midland, Odessa, but I'm still buying it. So Sonia, we got to get HEB in El Paso. I'm here to help do that.
Okay, thank you, Cindy. Dr. Kimberly Alvarez, want to say hello, please?
Hi, good morning or good afternoon. I'm Dr. Kimberly Avila Edwards, a general pediatrician, originally from El Paso, spent a number of years practicing in Buda, Kyle, and I'm now the Director of Advocacy at Dell Children's Medical Center, and I'm the Medical Director of our Children's Health Express, which is Dell Children's mobile clinic. Thank you for the opportunity to be here.
Thank you. Dr. Gonzalez.
Hello, everyone. First, thanks to Mark for having me here with you wonderful people. Glad to be here. Superintendent of Schools for Mcallen ISD. We have 21,500 students. We have over 3,000 employees. Our county is currently a hotspot with over 31,000 cases right now. We've had 1,500 fatalities, but we're powering through it. Our kids are doing 100% remote learning right now. Our teachers are teaching from home, and we're doing a phenomenal job as an A-rated school district.
All right, thank you very much. Dr. Garcia.
Hi, good morning. I'm Adriana, or good afternoon, sorry. I'm Adriana Rocha Garcia, and I am a city council member for District 4. I'm also a professor in the marketing department in the School of Business at Our Lady of the Lake University, and I'm happy to be here and wear both hats today, and so talk a little bit about business and what businesses can do, but also to talk a little bit about the disproportionate impact that the coronavirus has had on my community. The district that I represent is one of the highest in cases and unfortunately in deaths. And so I am ready to learn from you all and brainstorm together how we could help this just get better, and so that we could prevent this from happening again in the future. So thank you for having me. I appreciate the invitation and look forward to the conversation.
And last but not least, the power hitter at the table over here, the man who anybody who does business in the state of Texas knows, especially with minority, Senator Royce West. Senator, you want to say hello, please?
I just wanted to say hello. I want to say good afternoon to Tamak, JR, Sam, Pauline. Thank you very much for inviting me. Frankly, I'm just trying to figure out where we are and some important issues as it relates to this COVID. I'm concerned that if Dr. Fauci's group has one interpretation, the CDC has one interpretation, and the White House has another, will that continue to sow confusion as concerning the efficacy of the vaccine, and so whether or not people will be able to take it, and will they trust it? And so those are some of the issues that I know that we're going to be looking at. But I thought it was an excellent presentation, and the model and the questioner was superb. I see why she's a justice now.
Thank you, Senator. Well, let's go ahead and get started, guys. This is we can't solve all the problems of the world right now, but if you look, we got a good cross section of team with not only with experience, but where our contacts are. You know, Cindy, as far as the Chamber of Commerce work, you do an excellent job. Dr. Edwards over there, I mean, the fact that you're a pediatric doctor as well, and the position you hold is going to be all key, because as we heard the other day on the news, of children don't get this. Hardly anybody gets it, and children don't get it. Dr. Gonzalez with the school district, I know down there in South Texas, I mean, you're probably what, 99.9% Latinos in your school district down there, and you're having to face this front line. Senator West, the fact that you are there and a power player in our state legislature, we're going to be looking towards you, sir, as this next legislative session to really get in there. And of course, Adriana Garcia, you're a councilwoman in San Antonio, right? And your district was where Lackland Air Force Base, they got the very first COVID patients, you know, coming off the cruise ship. So as we look at this, and with Sam, head of TMAC, with Pauline, president and CEO, we have the resources, guys. So what we want to do is have a little discussion to see how we can collaborate and work together to come up with, if not the solution, but to keep educating our community. Senator West, you said a very important thing. When you see the White House and the CDC and Dr. Fauci, they're not on the same page, there's some concern. And our communities, minority communities, the African-American community, the Latino community, all the communities out there are a little confused, as well as a lot of others. It was interesting that we had a lot of questions that came in the call on the, when they were registering. A lot of the questions came from doctors, from medical doctors who are confused themselves. So moving forward, what TMAC is wanting to do is to be a facilitator, if you will, of information and to get this information out. And we're hoping that each of you on this call will rejoin us at a later date so we can have periodically little discussions and brainstorms how we can get it out there. Now the TMAC, we're going to dedicate some pages on the TMAC website to this. Your pictures, your bios are over there. And as we get information, we're going to post it so people can get it, copy it, and repost it and get it out there. So it's kind of like, we're not holding back anything. We want to just go ahead and get information out there to our folks. So I'm just kind of opening it up right now. I'll be moderating. If anybody has any ideas of what we can do to make sure we're getting the information out there to the right people, and where we give it to them in such a manner that they feel comfortable and confident that it is good information.
Yeah, if I could just share with you the current survey we did with our business members as a start point. Our businesses basically have said that there needs to be a component where you maintain a consistent message regarding what businesses must do to maintain the public safety of their customers, employees, and themselves from the spread of the virus. I think TMAC could play a key role in framing that consistent message, keeping and providing information about information resources available to businesses. TMAC as a state could be a channel to each community on what resources available to do that. The other part is public sector, public administration is avoid threatening businesses with closures for not meeting their requirements. Instead, educate businesses better on how to satisfy the requirements, because they're all over the place and they're getting so many mixed messages. And remind all governments at all levels that businesses are not the enemy in this fight against the virus. Governments need to keep in mind that in order to survive, pay salaries, pay taxes, businesses must remain open with all the safety protocols. So those are four, I thought, some very key, insightful messages that we got from our business members.
Hey, JR?
Yes, sir.
I'm not gonna take time myself, because we have so many other persons we want to hear from. But you said something about and somebody did say, and not you, children don't get the virus. Well, in fact, they do, obviously. But I think you meant somebody else said that children don't get the virus, and we know who said that, and we know that that's not the case. I just wanted to clarify that in case somebody didn't kind of pick up on that. But anyway, I myself, anytime I like to pass it on to Dr. Gonzalez because of the situation and the sensitivity with children going back to school. And obviously they are susceptible just like everybody else. And, you know, Mcallen ISD is a leader in education in the Valley, certainly, but all over. So Dr. Gonzalez, if you could speak to that, I'd appreciate it.
Yes, sir. I think that one of the things is just really working as a unit. And when I get to an opportunity to meet with great people like you all from throughout the state, it reminds me of not only communicating locally, but communicating statewide and then being as consistent as possible. I know for me as a superintendent of schools, I work very closely with the mayor in the city of Mcallen, with the Mcallen Economic Development Corporation. I'm with the board on the Chamber of Commerce. So I have a tight-knit group of individuals here that are working hard to create an environment where we can get our kids back into school safely. We're currently working at 100% remote right now. But as I say that, I start to think, well, how can we spread our wings and go beyond just working with these local entities that I've been working with, but start to work with individuals like yourselves to spread the message and how we can have a collective impact together. And that's really what we're trying to do locally. But as I think and I listen to you guys, I'm thinking, there's some power in this group and we need to work together to get that out.
Absolutely.
I'm going to piggyback off of that, if you don't mind. And thank you, Mr. Guzman, for clarifying that statement about children. As a pediatrician, I'm here to share my experience with children. And I'm here to share that really there is power in data. And having this forum where you can share data and for TMOC to be a source that can continue to share that is very important. As a pediatrician, it was very, very sobering to hear 2 weeks ago that we had crossed the 500,000 patient case number for children. And actually yesterday, we were just very close to passing the 600,000 pediatric case number. And everything Dr. Fauci shared in terms of disparities that we see in adults is being seen in children. I'm here to share that in terms of data, we know the American Academy of Pediatrics and the Children's Hospital Association has a joint report that they put together every week. And we know that 10% of all cases of COVID-19 are in children. And we have seen disproportionate numbers of hospitalization and severe disease, which granted is less common in children, but it still exists in the Hispanic community. You know, I'm here to share and to thank all my colleagues for everything they're doing each and every day. But we can always, as providers, we're looking at ways to constantly improve and have process improvement. We can improve our data. There are gaps in data. We don't have all the information that we need at a state level in many states with regards to children. I think 8%, according to this joint report from the AAP and the Children's Hospital Association, 8% of Texas data is has age distribution information with it. But I can tell you at Dell Children's, a part of Ascension, that of the children who have tested positive and admitted into our hospital, 72% of them have been Hispanic. And for those who have needed to be in the ICU, 82% of them have been Hispanic, very disproportionate. So what can we do? We can continue to share data. We can share ways to mitigate the spread of the disease, just like Dr. Fauci so eloquently stated. So thank you, TMOC, for letting us join you today and, you know, getting out there, meeting the need. I practice, you can see I'm on my mobile clinic now. We provide health services for 100% uninsured children. So getting to where we need to be, Ascension is very good at partnering with our community, getting non-hospital grade PPE out into the community and believing in our mission and getting the resources that individuals need, especially within our community.
Well, Doctor, thank you very much, not only for what you do, but it's great to, you know, that's a cool little mobile clinic you have there. Going out there helping the folks.
Yes.
Councilwoman, you are a councilwoman in a major city in the U.S., San Antonio, Texas, with a large Hispanic population. What are you facing over there? What are some of your priorities that you see?
Sure, absolutely. Thank you for the question. Well, my district, the district that I represent is a majority Hispanic district. We have over 80% Hispanics in my district. Unfortunately, we have 13.5% of the total share of cases in San Antonio. We also have 13.4% of the total death rates in San Antonio. So as you can see, this has become, it's always been the priority for me since I learned about it back in January. And of course, you mentioned it earlier, we received the first cases in the US of residents with COVID because Lackland Air Force Base is in the district that I represent. So I became very familiar with this back in January, started doing some research. In fact, I ordered my Dr. Fauci fan club sweater back in February. And so I've been on that, but in San Antonio, 47.6% of the cases of the deaths specifically are Hispanic or Latino. By the way, 28.1% are haven't been identified just yet on the race. So I'm anticipating that will be a whole lot bigger as well. But as I was seeing the numbers come out on a daily basis, we would see number of people on ventilators. We would see that the demographics, you know, again, just incredibly disproportionate and specifically towards Latinos. And so hospitalizations, Latinos account for 70% of hospitalizations in San Antonio. And so again, what Dr. Fauci mentioned about underlying health conditions, entirely see it true. So diabetes, hypertension, heart disease, those are all issues that residents in my community face. And by the way, we have about a 26% on people who don't have insurance. So that becomes even more critical. And by the way, a lot of our residents still do not use social media. There's this thing called the digital divide that is alive and well, particularly in my district. So it became evident that we needed to connect with our residents. And so every day, as we're looking at these demographics and total cases, and by the way, 74% of the population in San Antonio, we have 53,000, almost 54,000 total cases. We passed the 1,000 death mark last week in deaths. And so as I was looking at these also, I have familia. We have familia, right? And in San Antonio, I have familia in Houston. So I'm looking all over at numbers. I'm looking at Tarrant County. I'm looking at as much as I can information as possible to understand and compare. And it's disproportionate across, right? Across the cities in Texas towards Hispanics. And so in particular, those with underlying health issues. And it became even more personal for me because I will let you know that I've had more than 30 family members diagnosed with COVID in my family. And different units at different times, both sides of the family. I've had at least 16 members in the hospital. So these numbers, as we were giving the updated numbers of people on ventilators and sadly of deaths because 6 of my cousins have passed away due to COVID-19. And by the way, these are cousins that were migrant workers when they were younger. My tia and my tío would travel up to Wisconsin and they would pick crops. So these are essential workers, right? They've always worked as essential workers. And I had this unfortunate theory that our essential workers were going to be the ones that were most affected. And in my district, we have a lot of essential workers. So today when I heard Dr. Fauci say that the number one thing that is affecting, he thinks is frontline workers because they have so much interaction with the public, I believe it. I know it. And so I have been trying to do my part to work with my colleagues, and my colleagues have been wonderful. They realize that there's 3 districts in San Antonio that have been disproportionately affected. And so we're working together. We're working with our local hospitals and the doctors, like Dr. Fauci mentioned, to make sure that even flu prevention, getting your flu shot is important. I just came from delivering food with a program called Meals on Wheels. And so I asked everybody, did you get your flu shot? And they were wearing masks, and I was so proud that they were wearing their masks. And it's going to take continued effort by us, the elected officials, us, the business community, and us in general as good residents to watch out for our neighbors and remind them to do the things that they should. But I'm just working on how to get the message out and continue the prevention, the emphasis on prevention and the emphasis on protecting our most vulnerable residents. So thank you for the question.
Oh, thank you for that. I am so sorry for all your loss with all the family members. Something struck me, and Senator West, stand by because I'm going to throw it to you here in a second. This is what struck me as our conversations. As we're looking at numbers coming out of the CDC, as we see the television station, those tolls, unfortunately, to a lot of people, those just become numbers. But what I've heard here on this exchange is something very real. Dr. Avila Edwards, you're telling me that those statistics from the pediatric ward are astonishing as far as how many children and Latino children. Councilwoman, what you're talking about over there, why couldn't we possibly use TMOC, where you guys give us your sourced information and we start compiling that and presented it in a way, because as people are looking, everybody has a different interest. If their interest is going to be, how can I protect my family? How can I protect my children in schools? How is this affecting this? Maybe if you guys, as you're vigilant in getting that information, send it to us so we can organize that in a fashion where people can go to the website and go, what's the latest or what's happening here? And compiling that with videos, put it in Spanish and in English and any other languages we can, and just make it a source. So that's going to be something that we're going to obviously need a little bit of help on, and maybe a little funding on, but we'll figure out something. But it seems to me that especially here in Texas, and I think that Texas is a good example with the Latino population, because I don't anticipate Latinos in other parts of the country, being different. We're all suffering the same thing. Let's see if we can't bring that together and use Texas as a model for that information. With that, Senator West, we have a legislative session coming up. We have an election coming up. Do you anticipate, or do you see any type of legislation that's going to be directed towards, specifically towards this pandemic and this COVID? Because we're going into a whole new world, and I don't think normal as we knew it is ever going to come back. We have to adjust to a new normal.
JR, I agree with you. And we know that we've had over 719,000 positive tests in the state, and over 15,000 deaths. Right here in Dallas County alone, we've had substantial numbers of positive cases, and right now there's over 6,000 that are active, with over 1,000 people that have died here in Dallas County alone. When you begin to think about, I'm not going to dwell on. All of us know exactly what has happened as a result of this virus. The question becomes one of recognizing that exactly what Dr. Fauci said, that when you look at per 100,000, you have like 348 Latinos that are impacted, 349 African Americans, making us the most vulnerable population. And what you're talking about makes sense in terms of having information available, but I would hope that the chambers of commerce, that the healthcare professionals work with us as legislators to tell us exactly where we need to be in this state. You are the persons where the rubber meets the road as healthcare professionals. It is incumbent upon you to assist us with policy that needs to be changed, and also the allocation of resources that need to be changed, and make certain, as Councilwoman Garcia said, that you help us to get the advocacy groups to show up, and also not only just show up at the Capitol, but make certain that we're persistent in making our demands as it relates to the resources that we will need in order to make certain that our communities aren't left behind. You have my pledge that I'll work towards that.
Thank you, Senator. And for those not from Texas or not familiar with the demographics of Texas, here's a reality. I know we're going in a census period right now, and minority communities are historically always undercounted. But if you could combine the Hispanic population with the African American population, the two groups are suffering the most. We're over 50% of the state already.
That's exactly right.
And so there is no reason that we shouldn't have a stronger voice, be louder, and take Senator West up, and each of us start lobbying our own legislators go, this is important. As business of the state continues, I think this group, if we work together, can really make an impact by lobbying that legislative branches and making sure that they hear the voice of the need of the community. Because if we're over 50% of the state's population, and our death rate and infection rate amongst our folks are the highest, that is just unacceptable. Something needs to happen. So that's one thing. Now, some takeaways, and we're going to go for a few more minutes here. So what I'm hearing that everybody's kind of agreeing on, we could probably use TMOC as a central point of information to do. And Councilwoman and Doctor and Dr. Gonzalez down in the school district, Cindy from a business standpoint, Senator West, I mean, you have access to a lot of stuff. if you guys can, whether a staff, a person, an intern can do some research in your areas and provide that to us, and then we can get some people over here and try to decipher that. And I think that would be a big plus. Also want to see about doing some, maybe getting on the road, coming down to your community, doing some more Zoom calls, videotaping them, and posting them. Because this right here is going to be taped. We're going to post it. We're going to put it on YouTube. Because the more people that actually watch this, I think it's the better, because they're going to learn from it. And we're looking, and my attitude is, and I think everybody here agrees, is that in this state of COVID and this confusion, if we don't take care of our own people, who will? We need to be the advocates. We need to take a lead. We need to be the champions for our own community, because guys, I don't think anybody else is, because they're just counting us as numbers and deaths.
Hey, JR.
I really want to.
JR.
Yes, sir.
Let me just say a couple of things real briefly. From the standpoint of, if we want to get something done at the Capitol and we gather some information with regard to policy, and we want to turn it into advocacy and then possibly legislation, we have the man to do that here within our panel. I say that from experience throughout the years. Senator West doesn't just sit on the information that we give him. He moves it. I appreciate that, Senator.
I appreciate the partnership we've had these many years.
Yes, sir. The other thing I want to say is to Cindy, because essentially this, as far as the time expansion of being able to accommodate 1,000 people was done by virtue of the fact that Cindy made that possible through her resources. Cindy, thank you so much.
You're very welcome. Very dedicated to the cause as always. Appreciate it.
Dr. Avila Edwards, you had a comment, ma'am?
Yes, sir. I was going to say, please count on us to join you in these efforts. And I just wanted to personally thank Senator West, because I think you're absolutely right. You know, when I look at our community, again, data, if this is information for us all to know, that Hispanic children, again, are the racial ethnic group with the highest percentage of uninsured children in our state.
Right.
We lead the U.S. with the number of uninsured children, and it's just, again, disproportionate for the Latinx community. So thank you so much, Senator West. I appreciate your words.
Thank you, Dr. Edwards.
And there's another key component we need to look at, and it was brought up earlier, but I just want to shed a little light and focus on it, is Latinos, African Americans, we're the essential workers. They're on the front line. They're out there every day being exposed, taking the risk. And unfortunately, we're ones with the least access to healthcare, obesity, diabetes, heart disease, all those other factors are prevalent in our communities. So as we look at that, let's start gathering data as well for those essential workers of how it's affecting them, and of course, reinforce the prevention measures. But we need to look at a workforce. It was, I saw a statistic the other day that kind of surprised me, that overall in this country, about 70% of the available workforce out in the country right now is Hispanic. They're Latinos. And the fact that the population since the last census, our community since last census, the Latino community is going to double in size one more time before it plateaus off. So with that said, if in fact we are the essential workers, we're the blue collar workers, we're the frontline workers, and this infectious rate and death rate amongst our folks is the highest. Like I said, that is just something that's unacceptable. We need to start addressing that. But Sam, to your point, Senator West, we're more than happy to work with your office. I know that you have, respect, sir. You've been there for a long time. You're a commanding voice. People listen to you. Not only do you talk loud, but at 6'3" or 6'4", however tall you are, you just scare the hell out of a lot of them. So thank you for what you're doing. So we're going to utilize you. We're going to utilize you, and you need to
whip, I'm here for. That's what I'm here
whip some of them other legislators into shape, especially the young freshmen coming in there that still don't get it, that haven't been around like us old war horses. J.A. Gonzalez, buddy, it's good to see you on the call. Guy, we're gonna need your input so much for having in schools, because you're not only you're kind of a petri dish over there with so many Latino students. It's kind of like, as I just can't help but think, is what happens in your district is eventually going to happen across the state and across the country. So we have a lot to do. Cindy, thank you. And I want to see Cindy get with you offline, that maybe we can expand some of those surveys you're doing to the other chambers around the state and around the country, so we can start collecting that type of data statewide and nationwide. So we can start looking at the data and coming to some, not conclusions, but to get the necessary data so we can look and maybe do a little bit of forecasting and preparation.
That would be great, because one of the things that I wanted to talk to Senator West was on a state level, as we get ready to do session that Tamak can do, was accesses to new sources of revenue for business. And
I'm sorry, Cindy, did you say that? You broke up on me? Say that again.
Access to new sources of revenue for businesses, creating tax incentives for small businesses, and tax relief during this COVID time to give these businesses an opportunity to get back on their feet and create revenue streams. They recognize that you all need the money. We all need the money in local municipalities, but they can't give you the money if they don't have customers by which to do that. So they need help at the state level on resources that allow them those new sources of revenue. Which
Well, you need to come up with some ideas. Give us some ideas for us to run, and we will take it to the Hispanic caucuses in both the House and the Senate, and gain support for it in working with the business. Okay.
I have three proposals. I'll send them to JR, and you all can glean them through.
And I have a new Garza on here with me, who's my legislative aide. So please, Pauline, he'll be in contact with you about getting that information.
Senator, I got one other request that we'll do a little bit of follow up on. Pauline, stay on the line, please. I think a good thing is before that session comes in, maybe through your office, we could coordinate some workshop sessions with the new legislators or maybe their chiefs of staff to brief them prior to the session on some of this stuff. So as they go into it, they're just not hearing it as it comes. They're brief going in, and we'll have a better understanding when we start coming back to them at a later date.
I will take that to the caucuses to make certain that we are able to get something done. Anufo, make sure we put that on the table so we can present it, and we'll coordinate with Pauline on that.
Hey, JR, was this panel accessible to some of the other people, 1,000 or so that may have seen it?
This panel's going on live right now. Everybody's watching.
Gotcha.
It's going to be recorded and it's going to be repeated. Guys, let's kind of go around the room one more time, and we're going to
JR, I'm going to have to get ready to leave because I've got a 1:30. I just want to say thank you very much, first of all, for inviting me to be a part of the panel. And for those of you that are out of states, how about them Cowboys? Talk to you soon.
Thank you, Senator.
All right.
Thank you very much.
All right.
Let's go around real quick. Any closing comments from the group? And then what we're going to do is we're going to take about a few minute break. Each of you are going to have the next code to go in, and we're going to have a press conference. And any press on the call, you should have that code, and we're going to be available to answer any questions. I know some press requests already have asked for Spanish language, so we'll kind of split up some of the questions and do that. So Cindy, you want to start? Any closing comments made available to the public?
Thank you all so much for allowing us to be part of this. We were very honored to be able to play that support on this very important issue. Appreciate your leadership, Pauline, JR, and Sam. You are a rock star for sure. So thank you all. Nice to meet the rest of you. I would love to continue this dialogue and get our businesses back to building those jobs and creating capacity for minority business. Thank you all.
Thank you. Councilwoman, any closing public comments before we go into the press conference?
Yes, absolutely. Looking forward to continuing again the work. I commit to working with you all, please. Yes, absolutely. Count me in. The City of San Antonio, Visit San Antonio, are great partners with us and have launched this Greater Safer Pledge. And so we have a lot of businesses that have taken a part of it. And I don't know if other cities are doing it, but we are encouraging folks to take this pledge, not only to look at social distancing and, face coverings, etc., but also helping people implement contactless payment wherever possible, right? And so being able to help raise and train employees on this new COVID reality, coexisting with COVID, and then hopefully the post-COVID environment as well. So definitely some things to consider as we look about this. We, as a council, put forth on an upcoming ballot. A part of it is on-the-job training for small businesses who need to get back into business, etc. So looking forward to having this conversation and sharing what we have learned here at the City of San Antonio, and more importantly, trying to make a difference beyond our community. So thank you for the invitation to everybody at TMAC, and looking forward to more discussions.
Thank you. Superintendent.
Yes, wanted to thank everybody. Excited to be part of this group. In Mcallen, we pride ourselves in providing kids with a quality education, but COVID has really put us in a situation just like every other educational institution. And we're working hard to provide quality healthcare through telemedicine and through registered nurses on every campus. But I'm excited to learn from you all. I know that Dr. Edwards with your mobile unit, to get some ideas on how that works and see how things are going in San Antonio and different parts of the state. So Mcallen ISD is all in on this one, and then we'll do what we can to contribute to the team and in the end do what's best for all the citizens of Texas.
Thank you. Dr. Edwards.
What an honor to just be a part of this panel, and my commitment is there 100%. These facts can be overwhelming, but we all can do our part. Each and every day we can wear our masks, we can social distance, we can wash our hands, and it is through partnerships and working together like this that we're going to raise up our voice to ensure that disparities are prevented, and that we're doing what we can to increase testing to the Latinx and African American communities, that we are volunteering to provide the needed resources for our communities, and that we share our concerns, and that we work with our elected officials that are so generously here to listen, so we can all help address the disparities that we have. So thank you so much for the opportunity, and it's just such an honor. Thank you, Tamar.
No, thank you for taking the time, Doc. TMAC President Pauline, any comments?
I want to thank everyone for being here today. This has been one heck of an opportunity for all of us. And to be able to bring it to you from TMAC, from BUTA, we are thrilled. And for the partners who have joined us today, panelists, they have all committed to continue this conversation. And for you, those that were here, you're all leaders, and we appreciate you. We're here as a resource, and anything that we can do to help. Thank you.
And Pauline, this isn't a political issue, it's a what?
This is a health issue. This is not a political issue.
Pauline is TMAC's secret weapon. We send her into rooms and nobody realizes she's really Latina down deep inside, you know. Chairman Guzman, any closing comments, sir?
Yeah, only to thank everybody on the screen and beyond, and we're gonna keep this thing going. It's a good thing. And only to say then, again, Cindy, thank your technicians, your young technicians, they're the ones that are keeping this thing together, and that's the task. So thank them a lot, Idali and the other young ladies.
I'll thank Daisy Patrick and Idali. They are super rock stars.
They are definitely rock stars. And I would, guys, I want to mention before I go, if you have not gone to the TMAC page, please go and visit the TMAC website. That's TAMACC .org. And you can go to TMAC Facebook page and follow us there, because we're going to be putting a lot of this information up there. Do want to reminder, thanking HEB. HEB came in. Without them, this call wouldn't be possible. So HEB, thank you. We also have out of Brazoria County, we have Community Health Network. Fantastic. Gina out there, what you're doing over there, thank you for helping bringing them to the table. Miss Cindy, I can't speak enough about you and your team over there with the El Paso Hispanic Chamber of Commerce, and your women's network and your SBA stuff, and the hub certifications that you do, and all the things you do over there with your staff. Definitely one of the best run chambers, by not just Hispanic chambers, but chambers in the United States. You do an amazing job. Also want to thank Latinx Newswire service for getting it out there, and a new partner is going to be coming to the table is Univision Communications Inc. They're going to be doing some stuff with us. So I just wanted to mention those to thank them, because it wouldn't be possible without them. And for us to succeed in the future, to make sure that we get this information out, and that our people, our community, gets the information they need. It's going to be a joint effort on all of ours. So we need to work together. And let me just say, folks, news media, we're going to reconvene at 1:30. You should have the code. Panelists, you can take a break. You can have to re-log in, and then we have the media to ask some questions. Till then, folks, stay safe. Take care of each other. Why? Because it's the Latino thing to do.
Mask up and keep
Mask up, guys. Mask up and take care of each other, because if we don't take care of each other, nobody else will. All right. Thank you very much. This thing is going to be posted at a later date, hopefully by first of next week, where you can review it. And if you have any questions, anybody who received a code, Pauline's email address is on there. Please ask your questions there and see what we can do to help TMOC. And if you're interested in becoming a part of TMOC, we could also do that. If you don't have a Hispanic chamber in your region, we can have individual memberships, or we could probably even start a TMOC chapter in your part of Texas. With that, thank you very much, and we are going to sign off.